Minutes. We'll be ready to go when we start streaming. 1 minute. Fantastic. We're ready to go. Welcome, everyone. Welcome to Medical Mondays with Dr. O. I am Dr. Tony Okwesami, and I host Medical Mondays with Dr. O. I'm a family practitioner, treat HIV and addictions in Maryland. But I learn a lot on these Monday nights, and I can't wait for what we have tonight. We have a new family, a new family member, Dr. Jeanette Linder, who is a functional and integrative physician dedicated to helping others harmonize health with entrepreneurial demands. With leadership experience in large hospital systems and private practices, she has managed budgets up to $40 million while building high integrity teams focused on safety and inclusivity. She emphasizes 5 key lifestyle factors, which I'm excited that she's going to share with us tonight: movement, nutrition, sleep, stress management, and connection. Known for her creative approach, she even dances in the exam room to inspire movement. And you can tell, even tonight, you'll see, I've seen her movements. Passionate about holistic well being, she learned to cook, practices Pilates, aerial yoga, pickleball, hiking, quilting, meditation, and lots of laughing. Without much ado, I'm going to yield the floor to our very own Dr. Jeanette Linder. Welcome.
Thank
Welcome
you
to Medical
so
Monday.
much. Let me get things rolling here. All right, we're going to solve all medical problems in the next 35 minutes. You won't need anything more when we're done. Okay, no, we're gonna scrape the tip of the iceberg, but kind of talk about why does lifestyle matter? And more importantly, how do I create lasting change? And I'd like to make it a conversation. There are a couple of slides in here that give you an opportunity for some input. So if you can open your phones and put your camera on the QR code to the left, or put in ahaslides.com/PK5UV, you'll be able to see my slides and interact. And you'll also be able to give me feedback if you hate it at the end or you have suggestions for it being better, okay? So why does lifestyle matter? So you can take a pill or an injection or, have an operation to make it all better. You'll lose weight, you look terrific, and everything's fine, right? Well, not necessarily. Everything has a cost, right? And how you look may not really be how healthy you are. So that's a maybe. And we're not going to spend all day talking about these different things, but we're going to maybe talk about a different perspective. The World Health Organization estimates that lifestyle diseases, think about that phrase. I did not learn that in medical school. Lifestyle diseases, diseases caused by the way you live, cause 71% of global deaths. That's 90% of type 2 diabetes, 80% of heart disease, and up to 40% of cancers can be prevented by a healthy lifestyle. So in more detail, heart disease, high blood pressure, and stroke. These are not mild things. Type 2 diabetes, obesity, especially visceral fat, the stuff that squeezes on your organs and increases your blood pressure and creates tons of inflammation. It's a very, very, very active inflammatory endocrine organ. Certain cancers like colorectal, breast, and prostate are very much related to lifestyle. Lung diseases like emphysema and asthma, non-alcoholic fatty liver disease, that's high fructose corn syrup living in your liver. I mean, just taking up space, and it has no benefit, even though I have called it the elixir of life because it makes me high when I drink that stuff. It is also the devil because then it ruins your liver and it ruins your metabolism and it makes you addicted. It hits that nucleus accumbens in your amygdala, which just makes you want more, more, more. And then you've got chronic kidney disease. Nobody wants that. Osteoporosis with brittle bones, Alzheimer's and other dementias, autoimmune diseases where your body is attacking yourself, like rheumatoid arthritis, lupus, and multiple sclerosis, and psychiatric disorders like depression and anxiety disorders. I know so many people with these things, and I'm not talking about my patients. I'm talking about family and friends, and I'm sure you all know them. And I'm sure there's somebody in the audience who has at least one of these. I know I do. So why now? Why did I go from over 30 years in radiation oncology, where I've always been interested in integrative and complementary medicine, to really get into this? I mean, this is actual footage from my refrigerator. I call it my fridge porn. It's super healthy, organic, all this stuff. I thought I was doing it right. Come to find out, I was not doing what my body needed. I was doing what somebody else's body needed. Everybody thought I was so healthy, but things caught up to me. I was winning the competitive suffering game. I could work longer with less sleep and see 52 patients and be too busy to go to the bathroom and, pound the caffeine and go to the gift shop at 3 o'clock so I could keep going. And then when everybody left, that's when I could actually get work done. But I was so exhausted and having snacker's remorse, that, oh, I wish I hadn't eaten that, but let me plan my next binge while I'm telling somebody they're going to die. How inappropriate and awful is that? And I thought that my compensation package really should be based upon bladder capacity because I did not have time to go to the bathroom. I did not listen to my body. I denied it. I kept going. This is not a happy, healthy thing. And look at my face attached to this burnt off neck. Not resting, you know what face. Okay. There was not much of a smile when I was exhausted. Okay. I saved that for my patients, but not for my family. Not very nice. So, first question. Have you ever had snacker's remorse? So get into aha slides. Ah, yes, at least one person can relate to this. I know I've had it many, 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 many times. God, I can think of so many times I just wish I hadn't done it. And in the old days, that meant the whole week was ruined. Might as well just eat whatever I want. All right. So next, why did this matter to me? This list of lifestyle-related chronic diseases was very important to me. I had very high cholesterol, almost 300. Okay, obviously, I'm a princess in the pea, and certain things are incredibly sensitive and cause me to have high cholesterol. I've never had heart disease or a stroke, but this was a problem, and I was looking at a statin. My A1C was rising. That shows your average blood sugar level over the last couple of months. And I was pushing on diabetes. I'm like, what? I'm eating all those healthy organic things. How can this be? And who wants to be diabetic when the CDC shows that diabetics spend over $16,000 a year out of pocket? That is not how I want to spend my money. That's a couple of really nice vacations. I don't want to spend that on being sick, not to mention missing work, retiring early than I want to, worrying about who'll take care of my kid, and missing out on opportunities because I don't feel well. Obesity. I'm not what you would call obese, but I was skinny fat. That's where your body might not have a wide shape, but the percent body fat is out of proportion to what it should be. And visceral fat going up. We already talked about how inflammatory and awful that is. I had that. Certain cancers. I don't have these cancers, but a lot of people in my family do. So I need to be careful. I don't have emphysema or regular asthma, but I have cold-induced and exercise-induced asthma, and I need to exercise. So how can I make sure that I minimize these problems? Thankfully, I don't have liver or kidney disease. I broke up with Mr. High Fructose Corn Syrup 99% of the time. That's helped. But I do have osteopenia. I've taken lots of steroids over time. They've been injected or inhaled or taken by pill and all sorts of other reasons. And, you know, I'm indoors a lot. I'm not getting the vitamin D. I don't live at the equator. So this is an issue. I don't have Alzheimer's and dementia, although you might be the judge of that after today's talk, but I have a lot of that in my family, and it scares me to death. Watching my mother and multiple relatives have this is just awful. So if this is preventable, why wouldn't I do something about it? Now, I don't know if I have autoimmune disease. I don't have rheumatoid arthritis, lupus, or multiple sclerosis, but my thyroid up and died. Was that, you know, I did have some high antibodies. Did I kill my own thyroid or did it die because of the sunscreens or other things I was using? I don't know. But I certainly don't want to develop these over time. And then thankfully, I don't have depression and anxiety, but my mood is clearly related to how hungry or tired or angry or lonely I am. And this is all related. So what does everyday life look like when you're metabolically out of balance? You might have multiple types of pain, headaches, joint pain, GI problems, muscle aches, cravings, 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 and they're cyclical. The more you get the sugars or the things that turn into sugar, the highly processed foods, the Franken foods, they hit your amygdala and your nucleus accumbens, and they hit with intensity and they make you want more. And that was a useful adaptation 2 million years ago or 200 years ago when we didn't have a corner store loaded with shrines to carbs all the time. You know, when oranges were in season, your body wanted every orange it could get. You ate them for a whole bunch of weeks and it was gone. Then you were done with oranges. Now we have them year round. And now we have orange drinks and orange candy where we have naked carbs that have nothing to stop them and slow them down. So they surge into our brains and make us high. They hit the same receptors as morphine and cocaine. I'm not comparing the devastation on your life as the same as an opioid addiction, but I want you to know biochemically, they're very similar. And then you can be very hangry. That's when you're really very pleasant to be around. We had a rule in our house that no one could argue before dinner because we were all beasts. We were so nasty. And the arguments did not go well. Fatigue, you know, you're hitting on more sugar and more caffeine, and then you crash, and then you can't think clearly. And maybe you start to worry yourself, obsess about your body, and criticize yourself. This is actually biochemical. It's not just that you have not been living in your principles and you feel bad about it. It's because your gut microbiome, those little tiny critters that live in your gut, actually can go in different directions. You can have pro-inflammatory ones that change the metabolic balance. You know, you make a ton of serotonin inside of your gut, and that goes directly into your brain. There's a gut-brain axis. So what's happening in your gut when you eat this junk food is it sends junk to your brain that can make you depressed and make you have body obsession and make you have cravings. It's all related. It's not your fault that you like these things. Our bodies are created this way. It's just the way things happen. So how do you feel right before dinner? You can put in whatever word you want. Hangry, fantabulous. I'm a delight. I'm so fun before dinner. I have tons of energy. Or maybe you're tired, or maybe you're irritable. But give me a couple of words about how you're feeling. Angry,
Agitated.
agitated. You know,
You
there's the
can unmute
tired.
and you can unmute and give your input, please, everyone.
Yeah, it takes a while for this to come up.
In the 50s for most folks, but not everybody. About 48.
Thank you so much. I think that I will make assumption that many of us in this population. I've been surprised with a lot of what you covered today. Because we're
thanks.
not, yeah, absolutely. We're not used to it. We had a different lifestyle in
Yeah.
Nigeria, and we've made assumptions of what we would be. But as we all get older, we're getting all this information that's a surprise to us. So,
Thanks. Well, there's lots more coming.
oh, good.
I'm
So,
gonna keep rolling.
oh, okay. So I thought Dr. O wanted us to, thank you.
Yes,
No,
thank you so
she
much.
asked, how do you feel before dinner when
Oh,
you're
okay.
hungry? I said,
Hungry, very
agitated.
hungry. Looking forward to fufu.
Yeah.
And our,
Yeah.
yep, fufu
Okay.
and our amala. Thank you.
Thank you. So conventional medicine is mostly pattern recognition with a pill for an ill. And this is not the doctor's fault. This is how we are trained, okay? There's very little to no discussion of the root cause. Are we really looking at what's making this problem up here? Or are we just looking at the result of the problem? So quite often these pills cover up the symptoms while the disease progresses. Diabetes is a great example of that. A1Cs rising and rising and rising despite all the medicines that people are on. So I just want you to know, I love my primary care physician. He's terrific. He had suggested that I start a statin for cholesterol. I didn't want to. I also didn't want to complain about everything that I was feeling. I thought it was just part of life. And I was embarrassed. I'm a doc. I'm supposed to have competitive suffering. I'm fine. I'm fine. And he's a great doctor, but I wanted to try something first. So this year, right before I retired, was a really tough year. I lost 13 family members and friends in a year, some of them to the pandemic, some of them to other diseases. I was trying to be integrative and complementary in a world that doesn't really pay for that. If you help people get better on their own, that doesn't make money for the hospital system. And the state of Maryland has a special gift of the Medicare waiver that makes it, there are unintended consequences. So I'm not going to blame the system. I'm not going to blame the state of Maryland. I'm going to say we weren't aligned in the things we wanted to do. Like I wanted to help people find what was on sale at the grocery store, get their grandmother's recipe, healthify it so that they could eat something they recognize, but be healthy and on a budget. Those things don't bring in money, and insurance companies don't pay for that. So I took my advice of taking care of myself and retired. A lot of things improved. I exercised, I slept, I connected with people, I managed stress much better, but I also worked with a functional nutritionist and I got worse. Just because it says functional in their title doesn't mean that they are compassionate. And she would tell me, "Ah, Jeanette, just eat when you're hungry." And I'm like, I'm always hungry. I can't go an hour and a half without being hungry. She's like, well, just eat when you need it. I'm like, I don't know how to do that. I've spent my entire career ignoring my body's messages. I am starving and irritable all the time. And so I started trying to do what she recommended, and I got worse. My cholesterol kept rising. My stress got worse. I had another loss. More relatives died. I had pain. Oh, I had so much pain. So what happens when you have inflammation? You get pain. And I was super frustrated and I was offered steroid injections and pills and procedures. And I was like, this has got to change. This is not working. So what happened? I met this amazing, curious, open-minded genius who recommended that I start studying different things or that I just try to get a test. And then I talked to the person who owned the company and I'm like, do you teach how to do this? So I started studying holistic methylation and then I started studying the Institute for Functional Medicine and advanced applying functional medicine in clinical practice. And every time I said I wasn't going to do something more, I signed up for another 100 hours of training. So I got to put myself through my own residency. And along the way, I learned to listen to my body for the first time. I found out that I'm not broken, that my life changed for the better. My cholesterol dropped 70 points in 6 months without a statin. And I've learned to adapt to life in a way that was much better than before. So I retired, I discovered, I recovered, I forgave myself, which is a continuous process. And I reinvented myself and unretired. It was like I could see again, and this tree came back to life because I was that burnt out matchstick that you saw before. So I promised in my internship when I passed my boards that Dr. Krebs and I were going to break up the Krebs cycle over here. And because I was like, you never need that. You only need that to pass your boards. Why do I need biochemistry and all these other systems over here? Well, Dr. Krebs and I are friends again, even though it's changed to the citric acid cycle now. And I finally understand what root causes are. You know, when you have a vitamin D receptor problem, it can affect your neurochemicals. It can affect your immune system. It can affect your histamine sector. It's unbelievably prevalent and important. If you have a COMT variant, then you can have all of these things building up, just like Lucy and Ethel on the Lucille Ball show when they're working in the chocolate factory. And let's say they're the enzymes, and those enzymes can't keep up because they have a SNP, a single nucleotide pleomorphism, where they're 70% or 30% of normal function. All the chocolates build up. They're shoving them in their pockets, in their mouths, dropping them on the floor. And now there aren't enough products afterwards because those enzymes aren't working. Or look downstream to the next enzymes, and they aren't getting enough of what they need because they couldn't create their products. This is exactly how metabolism works. And in order for it to work properly, you need to have the orchestra working, which blew my mind. This is the root cause stuff. Now, what runs all these enzymes? Micronutrients and habits and all those modifiable lifestyle factors of nutrition, movement, sleep, connection with others and yourself, and stress management. And stress is not just how you're feeling or how your boss treated you. It's everything in, on, and around you. Do you live next to a highway? Do you have lead paint in your house? Have you been eating Frankenfoods your whole life? All sorts of things. Do you have conflict with someone you care about or conflict with someone you don't want to even know? All those things affect your biology. So how do we reconcile this with conventional medicine? Conventional medicine is clearly superior for emergencies, infections, trauma, heart attacks, strokes, cancer care, structural problems, and other things. I am integrative. I still practice radiation oncology. I consider it crisis intervention. I love it. I do it on my own terms, part-time now as PRN coverage. But I consider functional medicine escorting people to wellness, which is very different. So I tried to help people who were getting cancer care. I told them that exercise is your biggest anti-inflammatory, and that when you sit around, your body thinks you're dying, and when you move, you send a message directly that you're alive and you intend to stay that way. And I talked about spirituality and journaling and all sorts of things. But most people couldn't focus. They were stuck on the lump. Every so often, somebody came back and said, I said, like, what happened to your high blood pressure medicine? And she's like, oh, I don't need it anymore. I said, you look so happy. And she said, yeah, I'm feeling great. I said, and you lost 15 pounds. What did you do? And she said, well, I did what you told me to do. And when I regained consciousness, I was so happy. Someone actually listened to me. And so I was like, wow, if somebody who's got cancer can do that, imagine if somebody who does not, or maybe they do, but they're motivated to change, because this is a hectic world that surrounds us with challenges all the time. So what do we also need conventional medicine for? Some chronic diseases only respond partially or not at all to lifestyle. We still need conventional medicine. So in my humble opinion, the way to go is a collaboration of integrative and conventional medicine. So if it was so hard for me as a doc to figure this out, I don't expect somebody else to spend hundreds of hours studying. How are other people going to figure this out? I felt compelled to help others. I missed serving humanity, and this became my purpose. I unretired and started trying to figure out how to help people. And I started with my biggest problem, which was listening. If you can't define a problem, you can't solve it. And I had no idea how to take care of my body. So I thought, if your body could text you, what would it say? So who here always listens to their body? Your options are, I do, no way, who am I? I'm too busy. This was me over here. Who am I? I'm too busy. Is anybody else listening to their body? It is not easy, especially when we live in a culture that encourages us to just work, 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 work. You don't matter. You have to deny your reality. Okay, so how do you listen to your body? My spidey sense was completely messed up. So I personally needed objective evidence. And there are a variety of gadgets that we can use, but the one that was the game changer for me was the continuous glucose monitor. And at that time, they were only available by prescription. Now you can get some over the counter. But I found out that there's a great reason for why I was so stinking hungry. Two big reasons. One is that I have reactive hypoglycemia. Now, I had an endocrinologist tell me in med school that most women who say they're hypoglycemic are hypochondriacs. So do you think I told anybody that I thought it was a hypoglycemic? Of course not. I didn't want to be a hypochondriac. Well, look at this glucose. It shot up to 180 with what I thought was a healthy meal. Chickpea flour, avocado, banana, dressing, honey mustard, turkey slice, whatever. I thought I had a good 3-4 ounces of turkey in there. Turns out that I spike with all sorts of things. Even certain things that most people would not spike from, I spike from. This has to be personalized. I also had to develop insulin sensitivity because I'd made too many stops in the gift shop at 3 o'clock. My insulin receptors weren't paying attention anymore, which is a big problem. I also got dangerously low glucose. I still remember waking up in the middle of the night and the windows were changing size and shape. I had really, really dropped. Now, was this because I was leaning on my sensor? Maybe. But look up here, it's still at 60 and 55. That is not a good feeling when you were at 180 earlier in the day. So that feeling of dread was my body thought it was dying. My blood pressure was dropping. I was sweating. My heart rate was racing, and it was awful, absolutely awful. So using these things along with some other tools really helped me understand. And we don't have time to go into other ways to listen and learn, but DNA assessment, measuring your body, especially your waist height ratio, super helpful. Testing your microbiome to see how inflammatory it is or how happy it is. There is such a thing as happy bacteria in your guts. Specialized blood tests, which most people don't need, but some people do. And the medical symptom questionnaire, which really looks at a lot of different ways to objectively evaluate your health. So I found this beautiful tool called the Wellness Score. Every one of these measures is evidence-based, related to cardiovascular outcomes. It's color-coded. Red has worse outcomes, yellow's fixing ahead that way, and green is happy. You get a grade just like you're in school, and it can really motivate you. So let's talk about this lady. When she first started, her waist circumference was 37.5 inches. She had a lot of symptoms that put her in the mid-range of misery. So she was red. Her triglycerides were 191, so that's really pretty high. Her hemoglobin A1C was 6.3 on metformin and on Ozempic, and she couldn't lose weight, and she felt terrible. She had tons of GI problems, bloating, constipation. It could be days between going, and that's an important way to get toxins out of your body. Plus, it just feels awful. And she was like, Dr. Linder, you're not taking my popcorn away. And I'm like, I am not taking your popcorn away. Number one, I'm a little scared of you. Number two, you decide what works for you. You're going to see what your body tells you. You're going to look at your glucose monitor. You're going to look at how you're feeling. And then you're going to decide whether the quantity, timing, and how often you use, I said that like a drug. How often you eat your popcorn is up to you. So a few months later, she had discovered that 4 cups of popcorn at night right before bed was a bad idea. It was one of many things that were spiking her glucose. And look, a lot of things got better. Not everything, but a lot of things got better. Her waist circumference went down 6.5 inches. Her symptoms went into the fantastic range. So many things improved. Her triglycerides went down to excellent. But she might say, okay, I'm great. I look great. I feel great. I can be done. But she's still a C, okay, even with all that hard work. And if she goes back to her old ways, she's never going to get off the Ozempic and the metformin. She's going to go right back. Her insulin resistance has not been solved. It has been temporarily improved by taking good care of herself. So this motivates her to keep going, which is super exciting. So once you've listened, then you're empowered. You say, oh God, I had a spike. What can I do? Maybe I go for a walk. I can recover from that. And then I can anticipate it. I'm going to a party. I know I'm going to have a little piece of cake. I'm not going to eat a 3-inch piece of cake anymore. Maybe I'll have a 1-inch or a 1/2-inch piece of cake. So I better make sure I get my vegetables, maybe a little bit of apple cider vinegar, which I think is disgusting, so I don't do that. I go for a walk before, after. It's always nice to have a walk. The Italian call it a passeggiata. That's an after dinner walk. It's good for you. Maybe you walk into the sunset, which is good. It's good for the person you're with, and it helps use up that glucose. And then you can start to plan without worry. So then how do you talk back to your body? Everything we see, do, think, ingest, apply, and surround ourselves with sends a message to our body. It is bi-directional. So think about that. Every time you make a choice, you're sending a message to your body. Would you talk to anyone else you cared about with the same judgment, criticism? Would you be loving or kind? Would you risk their health every time you do something? I think our own bodies and souls deserve the same kind of care, right? So you have to be ready for this kind of change, though. And the Institute for Functional Medicine has a really nice handout on readiness. Not everybody is ready to make big changes or even little changes. And so there's somebody else told you might want to change, but you're not ready. Popcorn lady, right? But then over time, she went through, I'm thinking about it. Okay, next week, I'm going to replace the popcorn, except for Thursdays, I'm having it at 3 p.m. And then she actually did it, and she saw the results, and she's in maintenance. But maybe she's not ready to start moving, or maybe she's not ready to start connecting with friends she hasn't seen in quite some time. People could be in multiple different phases of readiness for change at any one point. So I want to ask you a really important question. Do diets work for you? Always, temporarily, sometimes, or no? You know, when people have looked at different types of diets, they've seen that about 30% benefit from them. The low carb, the low fat, the this, the that. I personally did not get more than a few weeks benefit from any diet. So I don't believe in diets. I believe in lifestyle. And that's because diets imply temporary, they imply pain, they imply unhappy, and that's just not a good way to live. So do you worry about medical bills, losing time at work, being sick and tired, maybe being forced to retire earlier than you want to because of your illness? Who wants to do that, right? Do you watch people you love suffer from these things? These are very real consequences of chronic disease. And it's a very big deal, and it wastes a lot of time and money and worry. And then you miss opportunities because maybe you made it to work all day, but you were too exhausted to play with your grandchildren at home, or you couldn't get off the floor because things are bothering you.
Mhm.
So, who here is ready to listen to and care for and about yourself? I already am. Yes, yes, yes. Soon, or no, I don't deserve it. There's a long delay between when people put in things and when it pops up on here. Sorry about that. All right. Well, this is encouraging. Somebody wants to take care of herself. So where do I start? We only have a few minutes, so we're just going to talk about the very basics. There may be somebody who's eating perfectly, but most people really are not. It's hard. We often live in food deserts or food swamps. You know, what's the first thing you see when you walk in a store, even a health food store? Junk. Okay. So eat real food the way it came off of or out of the ground. Eat mostly plants. That doesn't mean be a vegetarian, but you need a lot of plants. All those enzymes in the metabolic orchestra require micronutrients from plants. And then honor your metabolism. As we saw, the rules didn't apply to me. Different rules apply to different people, okay? So, basic guidelines. Replace frankenfoods with real food. That does not mean that I am a perfect angel all of the time. I am not. I have my moments where I enjoy things, but for the most part, I'm so much happier and easier to be around, and I'm healthier, that when you make the priority getting those numbers of servings of veggies and all that stuff, there isn't a lot of room for junk. Like, I thought a serving of rice was 2 heaping cups, which is really 3 cups. It is not. It's a quarter to a half a cup, which really made me mad. And now that feels right. But I had to go through that period of being mad. You should eat your vegetables, fat, and protein before carbs whenever possible. It slows down the absorption of the carbs. It gets in those things that are more important. We can live without carbs. We cannot live without those other things. And it creates kind of a filter. So everything is in your stomach, so it goes much more slowly into your bloodstream. And then you want to stop eating 3 hours before you go to bed because you're not moving in your sleep. So you don't need glucose in your bloodstream. You need time to absorb that glucose, send it to where it needs to be, and let your gut rest. It's also the only time your brain can clean itself. And if you still have glucose in your bloodstream, you might not sleep well. You might wake up early. You might feel bad. You have to pee a couple times because those are the consequences of having high blood sugar. And then you should wait 3 to 4 hours between meals, which was impossible for me. I couldn't imagine that. Turns out, not only was I spiking my glucose very commonly with all my super delicious seedless grapes and carrots, carrots spike me. That's so unfair, but it's the truth. It's just the way that it is. I wasn't getting enough protein. Protein is a way to get your own GLP-1. You need at least 30 grams, and certain people with larger bodies might need 40 grams of protein to make your own GLP-1. So you don't need an injection that might knock out your hair and stop your gut motility and do all sorts of other crazy things that these drugs can do. So I can actually make it 4 to 5 hours now. Not always 5, but 4. So whenever possible, you want to buy or grow these kinds of foods, organic foods. They don't have to officially be labeled organic. They don't have to be fresh. They can be frozen as long as they're fresh frozen. That way you can save money. You can go to a farmer's market. You can go to a community share agriculture thing. You can barter with friends where you're growing one thing and they're growing another thing. You don't have to break the bank. But think about all the money you spent at fast food and other restaurants that you can spend at home. And I used to not cook. I can now get my meal cooked, eaten, and cleaned up before I would have finished my meal at a restaurant, and I didn't have to pay 2-3 times as much, even though I'm buying organic. Free range, grass-fed animals, dairy, and eggs, super important. Anybody seen a store-bought egg that's in one of those chicken farms where they're all smashed together and they call them cage-free, but they can't move? They're not in cages, but they're in hell. It's awful. And compare that to how a pasture range raised, I should have said pasture raised, not free range, pasture raised, where it's eating the seeds and the grasses and the clovers and all that stuff. They're bright orange with more choline. They're beautiful and they taste better. And then wild caught fish, super important. Remember that Rome was not built in a day. You want to make incremental changes. And remember that relapse is part of the cycle of change. We often learn more from our mistakes than from our successes. So that is just what's going to happen. You need to forgive yourself and move on. So these are some books that I found really helpful for developing habit. You don't need to know the whole theory behind it. You just need to know that habit stacking is a repetitive thing, so you create habits instead of making resolutions. For instance, I kept forgetting to take my medicine. How can I yell at my patients if I can't take them myself? So I brush my teeth every night and every morning. So I keep my pill bottles with my toothbrush. I take them out at night, I brush my teeth, I take the night ones, put it away. In the morning, I brush my teeth, I take the morning ones, I put it away. Counter's clean, everything's done. Now I only forget if I'm on a plane overnight and I forgot to stick it in my backpack. So it's kind of cool. I'm not a hypocritical ding dong like I was before. But the main thing is you have to keep trying over and over again until you find a habit that works for you. So what's my philosophy? Lifestyle first. As few supplements as possible, though I do think some are needed for most people because our soil is changing and different things are available and the lack of sun that most of us get for being indoor knowledge workers. And there are millions of supplements that we could sell based on your DNA profile, but that could actually make you feel terrible and waste a ton of your money and make you lose faith in getting to learn what your body needs. So lifestyle first. And then focus on non-scale insights and victories. How am I feeling? Am I hangry? Am I stable? Am I anxious? Am I happy? Do I have pain? Am I isolating or connecting? Are my labs and anthropometrics, my body measurements, improving or worsening? Do I love and accept myself exactly as I am right now? That one took me over a year of doing my little inner child daily meta prayer. I like my little kid. I'm still working on liking my adult. These are things that take time and they take courage. And these things can be hard. You know, when I first agreed to do a sugar detox, my nurse just started laughing at me because I said I would do it before I really knew what it was. Then I found out how much I would have to give up, and she was laughing because she knew every day at 3 o'clock I ran off to get the junk. But you know what? That actually scared me to not be able to get to my junk. How would I deal with the emotions I was trying to cover up with my junk food? Well, I did it, and I was okay. And we do hard things all the time for other people. We can do them for ourselves, right? So that's why I developed the metabolic communication method to learn to work with these things, listening, personalizing it with epigenetics, and group visits are really, really helpful. It makes such a difference when you can find your tribe. Group visits have been shown to improve outcomes. You feel seen, heard, and understood. And my patients often teach each other. And this is not completely benevolent. This also helps me. It holds me accountable. I learn from them. I love it. So after you've learned to listen and empower, then you can adapt your modifiable lifestyle factors. As you age, things are going to change. As you travel, as you mourn. I lost my husband, and that was a big adjustment. You know, at first I couldn't eat, and then I wanted to eat everything. Now, is that really the best way? Feeling the feels probably would have helped me grieve faster, but I waited a couple years to learn about this, and then grieving became easier for me. If you get a new job, other sorts of things that are stressful that are going to happen throughout the next couple decades of your life, you can learn to adapt. And then forgiveness is so important. Forgiving ourselves. It's not our fault that we like the things that we like. It's not our fault that our metabolisms are the way they are.
Okay.
And forgiving other people is really important. For instance, first I had to get mad at the people who were telling me that, you know, only hypochondriacs say that they're hypoglycemic, or maybe a doctor told you that you weren't in pain when you were. That's a very common issue with people of color, that they are disregarded and not listened to and treated badly, or it's your fault because it's calories in and calories out, and you should be exercising more. And that's not necessarily true when you're in a metabolic storm. Calories in and calories out are not the same when they're frankenfoods as compared to organic. So maybe you go through the process of recognizing that you're angry at them and then forgiving them to get that stress out of your system, because that's just one more thing to put you out of balance. So what's the one thing that you might want to start with? Do you want to add more vegetables, buy organic, increase your water? Do you want to move 2 minutes every 30 minutes? They showed actually that when people worked out for an hour and then they were knowledge workers, which means they sat on their butts at the computer all day. I'm a knowledge worker. They looked at their average glucose compared to people who moved 2 minutes every 30 minutes. And they weren't doing big stuff. Like, I tell people to go to the bathroom on a different floor, or walk around the house, or I jump around and do this so I get my 1 minute of activity on my watch, which I'm not going to get tonight because I'm sitting here with you. But they showed that average blood glucose was better when people moved 2 minutes every 30 minutes than when they worked out for an hour. And that's because they kept their insulin receptors at the surface, ready to grab that glucose. And they were also using it up all day long. Or maybe you want to add lifting weights. Maybe you want to improve your sleep by stopping screens a few hours before bed, or sleep in a cool, dark room. Make plans with people in person or by Zoom, write letters, or work on stress. You want to cultivate your surroundings. Who gets to be in close proximity to you? There are times when you can't help but be around people who aren't serving you, but the rest of the time you can make that decision. You can work on the relationship, or you can decide, maybe I need to limit my time with person X or person Y so that you can enjoy them and then get out of Dodge when you need a break. And buying organic also reduces stress. You know, all the chemicals in the non-organic foods, 25% more cancer than people who do not eat. Than people who eat organic. So your risk of cancer goes down by 25% when you eat organic. That's a big deal. Or maybe you just want to breathe, which helps lower your blood pressure and makes you happier and increases your heart and brain synchronicity or resonance. And I always recommend being a Labradoodle. This is my very glamorous dog, Monty Linder, who only eats when he's hungry. It's kind of a miracle. I don't understand it, but that's why he looks so good. And be a goldfish. Ted Lasso said they only have 10-second memory. So when you screw up, okay, acknowledge it, learn from it, and move on. Be a goldfish. So get outside in nature. It's good for the soul. Do things that bring you joy. Like for me, it's sewing. Get out and move. Get out and do the things that make your heart sing. Okay? So, what is one supportive thing you could start doing now? And if you're not into the AHA slides, just unmute and scream it out so that we can hear it. But I would love to have it populate up here for the people who are going to watch this later on? Are you going to eat differently? Are you going to move differently? Connect? You could just say phone a friend, or you could say sleep longer.
Someone says, I'm taking a short break. Okay.
Yes.
She loves those things, labradoodles and fish and outside your hustle.
Lovely. And I haven't been able to watch the chat, so I'm going to have to.
No, I'll read it out to you. Don't worry about it.
Thank you. More
Someone
short
says,
breaks.
someone says getting more sleep.
Yes. Lovely, lovely, lovely. Okay. So,
I'd like to do the 2 minutes every hour. I mean, that is certainly within reach, and that's great.
it is, and it
That
can
sounds
be
so
silly.
easy. Why wouldn't I try?
Yeah, you can get the hula hoop. Where's my hula hoop? I moved it to another room. You can do
Walk
all
more.
sorts of things. So I just move my arms around, and
I can do that.
when my partner and I have meetings, we end them like this sometimes. We're crazy.
Thank you.
Okay. Well, thank you.
Dr. Alu says walking more. Dr. Fawale says moving more and getting more sleep.
Comes down to identify.
And Dr. O, that those 2 minutes quick breaks a great idea. You always
Yeah.
think you need a lot, but 2 minutes every moment. Yeah. Awesome.
Yeah, just going to a different location to go to the bathroom gets you some steps. And somebody said, what's a Frankenfood?
Yes.
You know, it's not too different from Frankenstein. It's had all the nutritional value removed from it. It is highly processed stuff that often tastes delish. I mean, I'm not going to say it doesn't, but it's highly processed foods that spike our glucose and are big contributors to insulin resistance, which is one of the biggest causes of chronic diseases. It's a big deal.
Sister Dominic said she'll love women retreats 1 weekend a month with all the other stressed single moms who need mental, physical, and spiritual rejuvenation.
Oh, I love that. Do you do that?
She would love to do that.
Oh, that's a great idea. My partner and I are thinking of doing that.
And Dr. Lodun says she'll love big and forgive fast. Love big and forgive fast.
Oh, that's nice. As long as you're keeping your boundaries and living in your principles, that's a beautiful thing. Love that. I can only do that when I'm taking care of myself. Otherwise, I'm really good at resentment and replaying conversations in my head. And that's when my gut microbiome is making me crazy.
Well, you have to remember what you just said.
Yeah.
About forgiving fast.
Yes.
Where's the slide? The slide that said, you forgive fast.
Forgive. Yes. It's a really important one. Where is it? It's right.
It's
there
right
we
there.
go.
Forgive. No, it's not that one.
Well, I like your point. It's a good one.
Forgiving fast. Yeah.
Yeah, that's terrific.
Yeah.
All right.
Comment.
Well, thank you so much.
Thank you. Can you bring that last slide back? I missed something, the very last one.
Yeah.
Thank you so much. This was fabulous.
You're welcome. Thank you for having me. I'm super excited.
Thank you. And thank you for being so open, really vulnerable, just sharing from your own experience to teach us that this is doable. You have done it. Bringing your cholesterol down 70 points is huge with lifestyle changes. And your A1C, which is your marker that shows what your blood sugar has been running in the last 3 months.
Yeah.
Those are huge with lifestyle changes. So I was looking at this. I said, I'm fascinated with this. Comment, Dr. O, for $100 of membership. So you help people along like almost a personal coach, correct?
Yes. So I started with a 12-week program, which was ridiculous. If somebody gets results in 12 weeks, most of those people are going to relapse as soon as it's over and go straight to Dunkin' Donuts or whatever. So then I made it 16 weeks thinking that would make a difference, and that was ridiculous. Then I made it 20 weeks, and then I was like, this really needs to be a year. You need to go through a full cycle of the year to see. And I didn't change the price while I did that. I think people need multiple touch points as they go through multiple stress points in their life to see how they're going to handle things. So I do individual medical visits, I do group visits. I have a big repository of educational information that I get from a variety of sources, some of which I wrote myself, some of which I found other people can do, way better with their graphics departments, Institute for Functional Medicine and Lifestyle Matrix Resource Center have some incredibly helpful things that I did not learn in medical school. I had to seek it out on my own. And even after 30 years of finding my own books and things like that, it wasn't like the deluge of information that I learned 2 years ago. And I'm still taking courses. I'm signed up for the Immune Advanced Practice module next. I've taken all the courses except for that one to get board certified, but I don't want to take another test. I'm too busy with things. So yeah, it's pretty exciting. So, and I also work with my fabulous partner, Michelle Lance, who's on the call. We have formed a business. She is somebody who rose up from bartender to Fortune 20 top executive at a national level and really can help women rise in corporate leadership and become entrepreneurs. And she was looking for a wellness person. And she saw me at a conference on a health panel, and she's like, we got to work together. You were talking to me. And we have not stopped talking since. And so we're putting workshops together to help people do this. Our website's being updated. So if you go to lancelinder.com, you might only see part of our information, but our next workshop is April 3rd. And that way you can work with us without me having to have a license. But if you're my patient, I can only take care of people in California, Maryland, Ohio, and Pennsylvania because those are the only licenses I have.
Fantastic. Wow.
Thank you.
Wow. And thank you. I'm looking at this. I keep staring at it. So people from Medical Mondays with Dr. O gets $100 off.
Mm-hmm.
Yep. Thank you. Because we did not discuss this, everybody. We didn't discuss this discount, and I was excited when I saw it. That's why I kept saying, please bring it back, bring it back.
Well, I've never put a slide like this up in my life. And I wasn't doing social media. I was really hung up on telling people about this. And then I realized if I don't tell people, I can't help anybody.
That's right.
I had to get over myself.
That's right. And thank you. Thank you for doing that, because in this time and age, we have so much going on. Cancers, immune problems, mental health, and we're linking it all back to food, to lifestyle changes, to sedentary lifestyle and stuff like that. So what you're doing now, functional medicine, is so important. It's life-changing. It's what every one of us need. And thank you. Thank you for this awesome presentation.
Thank you.
For accepting my invitation and coming out. I am very grateful. We do have questions, and Medical Mondays with Dr. O family knows if you have any question, you can raise your hand to ask. Then you have priority to ask or put it in the chat box. I promised Zubair, he actually logged in from Nigeria. I promised him I was going to ask this question. And the individual of
in the middle of the night.
Yes. So he said he's interested in understanding how conventional medicine can be integrated with our traditional healing practices. Could you please share any insights on how these two approaches can coexist and benefit patients in different cultural contexts, especially in countries like Nigeria?
Well, I think that's super important. There are a lot of practices that have been observed in China and lots of other countries for decades that are very, very helpful. And we Western snobs can often say, oh, that's that's not really the way to go. There is probably great wisdom in there, and we need to learn from each other. We need to learn when's in an emergency and you need to do something differently. Perhaps the local law is going to be way better than taking something from a different country across an ocean. You know, we have to be very open. We have to listen. We have to see what the success is. We also have to be careful when we take an assumption that something that works in one country will work in another country. We need to personalize it. Okay. And we also need to be careful about when one country brings all their frankenfoods over to another country and ruins their health. Look at the indigenous of Australia and Hawaii and other places that became incredibly unhealthy when frankenfoods were introduced. I know that happens in lots of places because that information I gave at the beginning about chronic diseases was global. It wasn't specific to one country.
Thank you. Thank you so much.
You're
On point. Dr. Olodun, she happens to be my niece family. She's a naturopathic doctor, and she's also a retired, I always mix this up. I don't know if it's colonel or lieutenant colonel in the army. So she says she said well care is the best first step approach to any illness. She said, please, let's connect. She would like to connect. She wants you to check out Trilera Holistic Care. I think we've posted your contact, but I'll make sure that, I connect both of you outside of this forum. You are in the similar field. She
Lovely.
posted trileraholisticcare.com.
Wonderful. Let me click on that, and then that'll be open in the background.
Fantastic.
Trilera, there she is.
So, Dr. Ajagbe, you have question. Kindly unmute.
He's the dental guru.
Thank you so much. I was doing thumbs up, animated thumbs up throughout your presentation.
Thank you.
Really wanted to, echo the fact that everything you were talking about resonated with me. I happened to decide to go into lifestyle change many years ago, and that has something to do with Dr. O. It didn't start to be like that, but when I used to have a very severe allergies, and I had a terrible asthma. And when Dr. O saw me, the first thing she said was, "This was not acceptable." Well, I knew I've gone to different places and received different consultations, and I've not received much improvement. When she asked me if if I would give her permission to take a look at how I'm going through this, that it would be good for us to be aggressive in addressing it. Well, I didn't know who she was. I didn't know she was a doctor. I didn't know what she was doing at that time. I didn't even know who she was as a person. So I said, "So how would you do that?" She said, "Well, if you will schedule an appointment in my office and we'll be able to talk about it." So I did. And anyway, to fast forward, I'm totally free from allergies, basically because I did quit cold turkey from all the things that came up in my results. I mean, when she saw my results, she screamed. She just told me, she screamed. She couldn't believe anybody could be have so many allergies.
Allergic to the whole world.
I'm allergic to the state of Maryland.
So when she said she couldn't talk to me on the phone, that I had to come in, that is something that we have to talk about face to face. I was a little bit, I think I was apprehensive to say, the least, like, okay, so what is this? What would my result have showed that she really can't tell me on the phone? So when I got there, she said I had to sit down. And then she said she has never seen any allergy list that is like this, that she wanted to know how have I survived till this point. Anyway, so the point I was trying to make is that I decided that day that I was going to make a lifestyle change. Instantly, I did a cold turkey quit from everything that I was allergic to on that list. And for about 15 years now, I've not taken any of those things that was on the list. So when you were talking about listening to oneself, I heard you talking to me like, wow, how many people talk to themselves? How many people listen to themselves? I do. And I do exactly what you are saying that people should be doing. So every opportunity I have to interact with people and they're asking me, how have I been doing? I try to tell them about lifestyle change. And that even made me to join the American Academy of Lifestyle Medicine,
Oh,
which, has different modules and everything like that. And amazing stuff. I mean, it's just that there's so much overlap between lifestyle medicine and the functional medicine that you espousing. And I think we all owe it to ourselves, to try to know much more about how to listen to our bodies and how to respond and to provide exactly what our bodies need for good health and, to just live a full, overall, healthy life. So another thing I wanted to add to it is when you were talking about the Krebs cycle, I was laughing because that was one of the areas of biochemistry that used to whoop us when we were in school. But then once one knows it, you know the basis of the causations of diseases. And that just brought back to my memory because I'm a pathologist. I was just smiling when you said that. Mr. Krebs was your enemy initially, but now he's your friend. That's a very important thing to remember. The last thing I'm talking about is MK7, mineconin, 7, which is a vitamin K2. And the importance of that, when you were saying something about vitamin D, receptors, I was going to say, well, vitamin D3 is important, but without MK7 or vitamin K2, it's really not as bioavailable as it's supposed to be.
it also will calcify your arteries. So you need the K2 to keep the calcium out of your arteries.
That's the reason
Super. Thank you for saying that.
I was going to raise that up that, okay, if we're going to continue talking about vitamin D3, we must always remember
yes,
K2 that must go together, just like we talk about, turmeric. Turmeric is not bioavailable without black pepper. So you have to have the two together for you to get the bioavailability of the, the medication or, the benefits that is in turmeric.
but then we have to be careful because if somebody's on a medication where K2 is going to increase their clotting time, like we have to be careful what we recommend. But in general, I recommend BioDK, which has both D and K.
Yeah, so the K2 is, one must be very careful if you're on blood thinner. Anyone who is on blood thinner should be very careful before taking a lot of K2 because it has to do with blood clotting.
Yeah, thank you so much.
You're very welcome.
Dr. Ajagbe?
Yes.
Thank you. Oh, wow. Perfect pronunciation. I am
Absolutely.
He taught me, he gave me a lesson.
Yes. Good job. So, Commissioner Tokwe Adeyoju, kindly unmute.
Hello, Dr. O, and thank you so much, Dr. Linder.
You're welcome. Nice to see
for
you.
being on here. Well, let me share my video so you could actually see me.
Thank you. Yay.
So,
Exactly.
I, it's amazing that Dr. Ajagbe touched on the topic of allergies because earlier on this evening, I was pondering an aspect of our custom. Dr. O, Dr. Ajagbe, and myself, we do come from a shared heritage, and in our culture, we do have people who have the ability to tell you, whatever method they're able to do so. It's I find it to be quite a mystery, but they call it a war. A war. In other words, things that you're forbidden from consuming or ingesting or touching or affiliating with. And I was thinking about it earlier this evening. Like, I wonder if there's any scientific connection between some of these things that they tell you to stay away from. Usually it's from the priesthood class of traditional belief, practitioners. And I was saying to myself, it would be really good to have some sort of scientific investigation, particularly ones that tell you don't eat onions, don't eat this fruit, don't eat that thing. And who knows how they're able to, come up with these, which I kind of um, it's a theory I was thinking about earlier on this evening. Like, I wonder if this is what our people will call allergies, this, or the Westerners call allergies, this AWOL. So I just said, let me just put it out there that anyone who's maybe a research scientist on the call, please give me a shout. I'd like to hear from you, and maybe we could, embark on an investigative study on this phenomenon. But that's
Very
it. But again, thank
interesting.
you.
Sure. Well,
I-
I'm from the Jewish tradition, though I don't keep kosher, but I had my family medicine. I actually started in family medicine. I was the president of the family practice club and everything. That's a whole nother story. And then God threw me down the steps and I changed my whole career. But the person who was running the family practice club at the time said, why do we keep kosher every day? And I said, so that we're not mixing the two different types of parasites together so that we get sick. And he said, that's the infectious disease reason. We do it every day to remind us that we're Jewish. And so there may be some biochemical or immunologic or infectious disease reason behind it, but why things continue into an age where food sources are generally safer, it's probably just, tradition. But there are some people who ethnically are more likely to react to certain foods than others. Maybe that's what's behind the onions and other things. It's always worth looking at. And, elimination diets are a big part of what we do, especially when you're looking at not just the frankenfoods, but highly irritative things like dairy and gluten and other things like that. And you can do your own tests to see how your body handles it. Try not eating it for 3 weeks and then introduce it at like every meal for 3 days until you have a symptom or until you find that you do well. It can take quite a few days to develop a symptom. Um, for me, it can be a week or so before dairy really kicks in. And then it can take a few weeks for me to get off of it. I do sneak it in here and there. But generally, I'm a lot happier with fewer allergies and things like that. I also had a similar allergy panel to Dr. Ajagbe because I was allergic to everything in Maryland. And was it a true allergy? No, some of them are. I have anaphylaxis to tree nuts. But when you have inflammation and increased permeability of your gut, big chemicals, big molecules get through that don't normally get through. When you heal and those little zonulin things that hold your cells together act like the fence they're supposed to act like, a lot of your symptoms will go away. So you might have antibodies to something because it's leaking through, or you have antibodies to something because you eat a ton of it. I was having avocado every day, and I had a whole lot of avocado
Oh, I
antibodies.
love avocado.
I love avocado. So they're different things. The main thing is to listen to your body and see how you're doing. Do you have a symptom that's not getting better? Then you really should look at things that and start with your traditions and see if they have some good advice for you. I think that's really, really interesting. I wonder if somebody's written about that.
Yeah,
You
I'm
right on the
curious as
money.
well. I'm
Uh,
curious as well.
yeah.
And then speaking of listening to your body, I realized many years ago that if I'm dehydrated, I typically will get like a bump right there, smack dab in my forehead.
Huh.
And yeah, and I'm not someone who developed a pimple, so and I kind of started to realize like, wait a second, I haven't drank much water, or I feel like bumps in really unusual places. So that's usually my cue that I take it that my body is telling me you need to, consume more water. So I
Yep.
make a
Water
concerted
helps
effort to do
wash
so.
toxins out. Yeah, I'm glad you pay attention.
Yeah.
You don't just get cover-up makeup.
Thanks again, Doctor. Have a
You're
pleasant
welcome.
evening.
Thank you too.
Thanks, Dr. O.
Thank you. These things
Dr.
are
Ajagbe?
individualized. They are. And I used to eat avocado every day too. It was Dr. Olodun, the one who is going to connect to you, who diagnosed me in a naturopathic way that I don't digest fat well. So I figured out that was why at a point when I eat avocado, then I got nauseated.
Mm.
So I had to stop eating avocados. These things are individualized and we have to pay
Yeah.
attention.
Or maybe it needs to be later on in the meal after you've had some fiber in there. Maybe you needed a break for a year or 3 months or whatever, and then you can reintroduce not in such high quantities. It's funny how our bodies can heal. I can tolerate, well, it might have taken less than a year, but I didn't test it. I couldn't have peanut butter in an apple without spiking like crazy. Now I can. That was healing my insulin resistance. Um, yeah, it's crazy. Now, I'm not perfect. There are certain foods that are going to spike me no matter what. And part of that is just normal. I mean, high fructose corn syrup, those naked carbs that don't have the fiber around them. I was juicing for quite a while. I had never done an alcohol shot, but I did kale shots with my daughter. Her name's Kaylee. And I found that when I made these delicious juices, they were going to spike me because there was no fiber around them. So it just shot in. And plus, it's not satisfying because you're not chewing. So I'm just going pinballing into multiple different directions, but there's just so much you can't cover in one little night.
I know. So we have to bring you back. That's what he had.
Thank you.
Before Dr. Jagwe, before I bring you back on, I just wanted to alert everyone to the fact that in the chat box, oh my gosh, Dr. Ajay and I have been doing a lot of work to post Dr. Jeanette's information in the chat box. Her website, Instagram, LinkedIn, everything is there so you can connect with her. And I hope we got it right. Somewhere too tiny, so I typed them out one by one.
It is a little hard. I feel bad that I couldn't look at the chat while I was talking. I missed a lot of great messages.
No, you should. That's my job to do. I
Oh,
go through
thank you.
them and then, I bring them to you as necessary. But, our information is in the chat box. And if you need it later, if you don't get it there, please reach out to me and I'll be glad to connect you. Dr. Jagbe, kindly unmute, sir.
Yes. Okay. On mute. I'm already unmuted. Anyway, thank you for your feedback, Mr. Adeyanju. I want to say two things. There are some that have the ability to tie family, history to certain things. So when you ask about those who create taboos for families or for individuals, they are very astute people, very wise people. Sometimes they will tell you for the family of so people, they shouldn't eat okra, they shouldn't eat this, they shouldn't eat that. Uh, there are many things that are not scientific, that are not proven scientifically but somewhere along the way, they have observed that ingesting or being exposed to certain things did have negative effect on them. And so, like Dr. Linder just said, listen to your body. Yes, there may be some people that seem to have the power to say that certain things may be bad for you, so abstain from it. If you listen to them, it will work for you. If you don't listen to them, it may not work for you. Personally, when I was a baby, I was told when I grew up that anything made from corn made me sick as a baby. So my parents told me, when you go to school, please do not eat anything that was made from corn. And for those of us who grew up in Nigeria, if you went to boarding school, you cannot avoid being exposed to anything made from corn, because one of the breakfasts that people will have in school will be made from corn. Some of the one that will be, in the evening will be made from corn as well. Sometimes they will cook beans with corn. So there was really no way of avoiding corn. So when I was growing up, I loved corn. Even though they told me it made me sick. But in retrospect, when looking back, I discovered that no wonder I used to have breathlessness. I would eat those things because they were delicious, but then I knew I was always breathless. I didn't have frank asthma, but I was always breathless. I love to jog. I love to do long distance running, but somewhere along the way, I would be out of breath. So it was after I got the results from my allergy panel that I was looking back and say, oh my gosh, I used to even ignore my parents wanting to not to eat corn, and I would eat it. Everything made from corn and peanuts, I ate them. Both of them were making me sick. So, so I can tell you, sometimes when they told us growing up, don't do this because it's not going to be good for you. If we listened, we probably benefited from it. I don't know that there is any, what I would call crystal ball or some kind of divination that could make some people know that somebody will be allergic to particular food. If that's what Mr. Adeyanju was alluding to. But definitely, there are so many things that our body tells us if we listen to it. When I was young, I hated bread. Almost every child of my age loved bread. I hated bread. It was later on during my allergy panel result that I discovered that I was allergic to wheat. Because I knew every time I ate bread, it was like I had a lump in my throat all the time. I would be drinking, thinking the lump would go down. But later on, I found out it was not the bread that was stuck in my throat. It was the thick saliva, which was a response, an inflammatory response to my exposure to wheat.
So what Commissioner Adeyanju was talking about, we address it as these things are individualized.
Mm.
So even back home, there is no general rule that a certain portion of people should not eat onions or something like that. But it is individualized, even back home. And your experiences right on the money from childhood, you have had these allergens, but there was no way of really testing them then.
Fascinating.
And yes.
And on the other side, Dominique Douglas has posted about Dominique, would you like to say yourself, or should I read what you wrote in
Yes,
the chat?
I think she should unmute. Dominic, kindly unmute.
Sorry, my phone froze and I couldn't control my screen for a second. Hello, peace and blessings, everybody.
Hi.
Yes.
I live in Orlando, Florida. and I'm adopted. So I went on to this history binge. You know, you're just like so obsessed now because you're adopted. And even though I know my family, I went and got a blood test. And it said that, because, you know, I says it's different when you can't go back but a certain amount of generations. And you really want to know where you came from before you got to New York. And it turns out so many different places, but the majority, Nigeria. And it just so happens that the reason I did this is because a friend of mine, she moved to Ghana for 2 years for a job. And this girl, we had worked together. She had a lot of like ailments, whether it be things she was allergic to or just responses that her body had to the weather, the air, certain products that she put on her skin. I mean, it was a struggle. And it's just that way for some people more than others. But there was an opportunity. I'm not sure how. I think there was a gentleman involved, but she moved to Ghana. And I just remember her telling me how all of a sudden she didn't have IBS anymore. She was like, "Yeah, they eat differently. It's cooked differently." She found some of her family some generations through, and it was just like a really beautiful thing. But she said her body began to change. And so that took me on a wild goose chase, and I found documents and different research that had tested generations and people who actually did from other countries, from countries all over the world. They did the same thing, and they found connections with the fact that once we're displaced from a place we originated, maybe that onion habit is a thing that's just in your family, but you wouldn't notice because you have another food that you eat that works as it's supposed to negate that one in which is missing in the diet in Florida or Montana or something. But now that's where we are at. And so finding that there is some genetic biomarkers that live in our gut that can go back and tell you way more than even a blood test for, you know, geographically on the world where some issues arise that maybe wouldn't have.
Fascinating. Thank you so much.
Yeah, thank you. Wow. Dr. Louis, I've spoken about that on this platform in the past, so thank you. Dr. Izugu, kindly unmute. There you go.
Yeah, Jeanette, thank you so much for the wonderful presentation.
You're welcome.
It's interesting that you went from oncology to functional medicine.
I went from the most technical to the most eat the way God made things.
Right. It's like you've seen the pathology, and now you understand you have to go to the beginning to prevent that pathology from happening.
Yep.
The key thing really that, from what about listening to yourself, and I'm going to bring that into the area of prevention. You see, listening to yourself is a key element in prevention of disease, the complication of disease, prolonging of life, and also reducing the cost of care. Take, for instance, the CGM you talked about, people, which is continuous glucose monitoring. Yesterday after church, we got a call. We're in the car. We got a call from a friend of ours that they saw their primary care doctor. Their hemoglobin A1C was 9. And they asked the primary care doctor about CGM, and the doctor says, you don't need it. I was very incensed. I actually said, I want to talk to the primary care doctor. And the thing is, if the insurance is not covering it, you can at least tell them insurance doesn't cover that. But to say you don't need it, it's not the right answer. Because if you have that CGM and then sensitize yourself to begin to watch what makes a spike, not only will you take care of the diabetes, but you're also going to reduce complication and manage yourself much better. And the thing is that this individual can afford to buy that CGM by themselves and pay for it monthly, even if the insurance doesn't cover for it.
Yes, and they're
You
cheaper
know,
ones that you can
and
get
that
now over the counter. And
it's
so that doc didn't know because it's not taught. In order to learn this, you have to, well, first of all, good on you for knowing this, but you have to very proactively go and seek this information because it is not out there. The American Diabetic Association used to say, well, just eat as many carbs as you want and take as much insulin as you can. Oh, now they are saying that CGMs are useful, but fewer and
yes.
fewer insurance companies are paying for them unless you're on 2 diabetes medicines.
Or
So
when you get into or when you start taking insulin, which is crazy.
Right. It's so terrible. So you have to be pert near heading for vascular and neurologic long-term side effects, maybe losing toes and feet before you can fix this, maybe losing your vision and having heart attacks. And it's so
Yeah,
wrong. At the same time, they don't know. And honestly,
yeah,
primary care docs work like dogs. Do they have
they
time to
do.
go study?
They do.
And they're
They
getting
do.
arguments from their patients who have
Yeah.
Googled and the whole anti-vax thing. They're exhausted and underpaid. So I don't expect them to know. I'm always so happy when I hear someone like you and Dr. O and the other folks who are aware of this, because it's not out there in medicine land because, well, it doesn't make money to tell people to eat well. And
Yeah, and
I'm not saying that
yeah,
they're doing it on purpose. This
no,
comes from pharma and the whole
yes,
culture.
an insurance issue, and we segue that for diabetes. We can also move the same for hypertension. See, remote patient monitoring, where you're checking your blood pressure daily and submitting to your doctor, and using that to control your blood pressure. Not only does that reduce the complication rate from hypertension, but things like stroke, blindness, kidney failure, heart failure, all of those can be prevented with just managing that. Then you can also see the food that spikes your blood pressure and then begin to remove those. So these
And the people who
concepts
spike your blood pressure.
on the locations, on the or places, But the thing is, again, this again underscores the concept of listening to yourself, not listen to your taste bud, but listen to yourself and how your body responds to things that go inside it. Because the body is a fertilizer, it's a ground that fertilizes things and grows things. So things that goes into it that's not good is gonna grow it. So let's just really use that concept for prevention. Thank you.
Here, here, here. And blood pressure has no symptoms until it's too late.
That's right.
Thank you.
So,
Thank you.
Jeanette, Dr. Zugu is a cardiologist,
Oh, fantastic.
but a cardiologist that is
In touch.
different, in touch. That's the
Yes.
word. It's in touch. And
Amen.
it's true. We didn't learn this in medical school. You learn. And I want to add, you guys were talking about insurance companies. I'm the primary care doctor. I sit in this place suffering this, even when patients are on insulin, they don't approve those continuous glucose monitoring machines. They may approve the glucometer, and some patients don't want to stick themselves all the time.
Okay,
So
so some cheap ones I'll put in the chat.
please,
$89 a month if you sign up for a subscription, which you can cancel after 1 month. If you just pay 1 month, it's $99, and that's Stello.com. There's also HelloLingo.com. Stello is a Dexcom one. Instead of checking it every 5 minutes, it checks it every 15 minutes, and it lasts 15 days, unlike the G7 from Dexcom that only lasts like 10 days. Way, way, way less money. I think Hello Lingo is $49 for 2 weeks. So it would be about 98 bucks for a month. Also, if you get a prescription for a Freestyle Libre 3, which is Bluetooth, and you go to Costco with a coupon, not all Costco's, not all coupons, 60 bucks if your insurance doesn't cover it. But not everybody has access to that. My
Libre
insurance
3.
paid for Dexcoms for a little bit. And then it happily announced it wasn't going to do that because they're so short-sighted.
I know.
I'm never going to be a diabetic because of this.
Amen to that. You know,
Dummies.
they are short-sighted because when they actually use these things, they approve them and prevent complications, it saves money.
Exactly.
Costs more money to now manage the complications. And
It saves
so
vision, it saves legs, it saves hearts, it saves lives, it saves cancers. We could go on for all night.
I don't understand it. I don't know who sits on that decision-making chairs. I don't know. Well, Dr. Jagbe, you have your hand raised again.
Yes. I thank you so much for all the contributions. I wanted to just um, kind of bring our attention to an area that I'm, very conversant with, and that is the area of the upper airway, the mouth and nose. As we talk about people listening to themselves, certain things the body might be telling them that they don't even know and they don't even understand what to do about it. For instance, for somebody who is constantly having nasal blockage, sinus problem, and they believe they are living well, but somehow they are, when they look in the mirror, they see their mouth, but they don't see any association between what the mouth looks like and the way they are feeling. So they may not be able to ask for help. They just go ahead and keep on taking something to unstuck their nose. They keep taking medications for sinus problems, seeing ENT and all that. But now I just want to address the fact that the underlying cause will probably be the jaws. If the upper jaw is poorly formed, in which case it's going to affect so many things. The nose is primary because the floor of the nose is the roof of the mouth. If anybody has, if you can do a self-evaluation or assessment by yourself to see if you need some help. If the roof of your mouth is narrow and deep, which means your tongue cannot reach to the floor, to the topmost part of the the roof of your mouth, that means your nose is compromised. I don't care how you think it is, because anytime the upper jaw is not well formed, the nose is affected. So if the nose is constantly blocked and you have a deep, narrow roof of the mouth, you need help. The help is to grow that jaw, to expand the roof of the mouth so the space in the nose can open up too.
I
Because
had an expander every day. My sister would crank it open, and it made a huge difference. Did you read the book Breath by James Nestor?
no, I didn't read that, but there are other resources,
Yeah, well, you practice in that field. I mean, it makes such a difference. Nose breathing and all these other things are so important.
that's the point I'm trying to make, that sometimes people don't know what their body is telling them because
Hmm.
they don't know what kind of help they need. And so not talking about it, just saying that I have nasal blockage, my nose is always blocked. Anyone who cannot breathe properly through the nose will be a mouth breather. And a mouth breather is not a happy person. I
We
don't
have
care
to bring
how
you back again for that subject. Because we want to stay on functional medicine today.
Okay, thank you very much.
so I
We
just
have
want
to bring you
to
back.
raise that part, that even when we are telling everybody to listen to their bodies and all of that, some things need assistance for them to identify. And once they begin to become aware of it, so now if somebody has heard me talk about this deep, narrow roof of the mouth and tongue tie, that is, their tongue is not able to lift all the way up to seal the roof of the mouth to create that seal so the nose can breathe, they will be suffering. If they
Okay, so, but honestly, we're going to have to bring you back to talk more about it. You've talked about this, but we'll readdress it.
Thank you.
Going back to functional medicine, I have a question.
Yes.
You talked about organic foods and, how important it is to eat organic foods. And, when we do that, it actually decreases the chances of becoming diabetic by a significant percentage. The problem is knowing that one is really getting organic food in the stores, because we've seen things on TV that says that some things are marketed as organic and they're not. Do you have advice on how one can identify authentic organic foods or where one can get it?
That is a great question, and I don't have full expertise on that, but I'll tell you what I do. I like to do community shared agriculture when possible. Chesapeake Bay Foundation has a farm. It also helps ensure that organic, healthy farming continues because you pay the amount regardless of, you pay a set price way before the crops are out. So you don't know what you're going to get. And that is a gamble that I think is worth taking because I want these types of farms to continue. So I pay X amount of dollars to get my vegetables during the year. You can buy a half share, you can buy a whole share. I get a winter share now, and I know that that is going to be healthy. Now, if you add it up, what I used to spend, I used to eat out almost every meal. I had fast food breakfast. I had hospital crap lunch. I mean, hospitals do not have healthy things. I complained to the hospital that a single serving bag of chips was really 3.5 servings. I thought that is just job security for the entire building. Just terrible. But I used to eat most of my meals out. And now I'm saving money by buying organic. And, I used to buy vegetables and then they would liquefy and I'd throw them away. I actually eat most of my vegetables now. I like to do things that are simple. I call it empty the fridge salads. I take out everything that you can chop and throw it into a salad. Add some pumpkin and sunflower seeds and olives and all sorts of other things. I have these fantastic salads and I throw in a chicken thigh because that's a naturally packaged 30 grams of protein. Or I do empty the cupboard soup. So I'll take some protein, or maybe I'll have the protein separate, because if my protein's all mixed up, I won't get enough. If I keep it separate, I'll get enough. So maybe I'll cook it all in and I'll throw in all these vegetables and it makes this huge Instant Pot thing, which is done in like an hour. Instant really is an instant. You got to come up to pressure, cook, and come down. But then I'll put 3 to 6 of those in the freezer so that if I come back from vacation, I have this healthy organic stuff that was ready, frozen, and ready to go, so I'm not wasting my vegetables. Or if I'm traveling for work, because I go to Pennsylvania to do radiation oncology, I will buy flash frozen vegetables. Now you asked me, how do I guarantee that they're organic? I don't really have the testing to prove that. But I try to go to places that are going to be more reliable for that. I do not know the answer to that. If something is a massive size and they're calling it organic, it's probably not. Or it's probably GMO or something like that. Like bananas didn't used to be the length of our arm, right? Bananas when we were kids were little bananas, right? They've been modified. And now they're covered in pesticides and things like that. I don't have a great answer for that unless you're working with a specific farm or you go to a farmer's market. It can still all be a lie. But here's how you know after you've bought it. If fresh vegetables are still good 2 weeks later, they're covered in preservatives. Things that are healthy, they die when they're supposed to die. So you can kind of figure it out that way, which is why you want to cook it within a certain number of days. Once it's cooked, it can stay in your fridge if you keep it cold enough. I have a little drawer that keeps things at 37 degrees, so my salads aren't a disgusting mess 6 days later. But I'm not going to prep every day. I don't have time for that. I'm going to chop, 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 and then I'm good to go.
Thank you.
Sure.
Thank you. We need to investigate in separate, different states to see where we can get those. Some farmers market, maybe, but then I don't know. But you are right on the money. If the vegetable is still there 2 weeks later, it is not.
It's covered in stuff.
Yes.
Yeah.
Thank you so very much. There has been on the platform, appreciations, amazing.
Thank you.
Haman Irish is from Britain. He actually called in from Britain and he says he appreciates the advice on vitamin D3 and K2. People are saying it's very informative, they've been blessed, and it's been fabulous. Thank you so much.
Thank you. Let me correct one little thing. Some vegetables last a couple weeks, like cauliflower and broccoli and stuff like that. But
really,
in general,
cauliflower and broccoli? Yeah, you're right.
yeah, yeah. But your tomatoes, they're not going to be lasting 2 weeks. That can't be real.
You're right. Yes. So can you please leave us with your parting words?
Eat real food, mostly plants, honor your metabolism, follow your gut instincts. If you feel like something's wrong, go talk to somebody who will listen to you and help you figure it out. If you feel like you're not being heard, find someone who will listen. There's so much to learn, and there aren't a lot of sources out there who have the time or the education to talk about it. And forgive your doctors. They're doing the best they can with what they have. And quite often they're wonderful people who just haven't been exposed to the information.
Thank you. And you know what? We are blessed to have you.
Thank you.
Because now you've become family.
Thank you.
On Medical Mondays with Dr. O. And for everyone on the platform, please, we have an amazing resource here. Our information has been posted over and over in the chat box. If you didn't get it, you need it, hit me up by email, text message, what have you, and I will connect you so that you can, have your own personal evaluation. All of these things are personal. Somebody can eat an apple, the other person cannot. It is personal, and you have to have your own personal evaluation, personal assessment to know what would be best for you.
Yeah.
So please connect.
Yeah, and thank you for staying up late in other countries. I appreciate that. Get some sleep.
Thank you. We appreciate you.
Thank
Good
you. I
night.
appreciate you.
So
Thank
we
you.
meet again next week, everyone. Please stay safe. COVID is still a real thing. I say this like a broken record every week, but it is. And there are also other viruses going on.